Hi, everyone. I'm Marissa Amici. I'm a certified aesthetic nurse specialist from Los Angeles, California, and I am co-founder of Skin of Color Aesthetics, which is an Instagram page and coming soon a training platform. And my co-founder and colleague and friend, Jacqueline Halpin, is here. We are so honored to have Theresa Reynolds with us today. I came across her, I think, on a Facebook page, and she was commenting on lasers for skin of color. And we are so excited to have her here to ask her all questions about lasers for skin of color. So welcome, Theresa.
Hello, hello. Thank you so much for having me. I am honored to be featured.
And we have to actually say congratulations to Jacqueline because she has recently passed her boards and now we can call her doctor.
Congratulations. That's huge.
Thank you.
How does it feel?
I'm still kind of in shock because I feel like school is still in session since I've been a professional college student, but right. I'm happy now because now I don't have to worry about it anymore. So yes.
Yeah, and you're expecting your first baby. So
yes, expecting the first baby. So there's like a lot of extra things going on this year. So
yeah. Yes. So we love to meet other passionate aesthetic providers, and we just want to hear everything you have to say, Theresa, about what you've learned with lasers. How we'd like to start it is just tell us about your story and how you got your start, and we'll go from there.
Yeah, so I have been in the field of medicine for quite some time. I started out as a medical assistant in 2007, 2008, and then just worked my way up the ranks, continuing education. I taught the RN program and completed my LPN in order to do so. So that's kind of where I landed with my title. As far as lasers, before lasers, I worked in infectious disease for a number of years back home in Seattle, learned a lot, got a ton of information under my belt doing that. And when I moved to Dallas in 2016, I was kind of tired of losing patients. I'm an empath, so it was just a lot for me in infectious disease, and I wanted to try something different. So I interviewed for a position as a manager of a cosmetic surgery office and got the role. But I only lasted about 3 months before the doctor decided that my medical background suited me better in the clinic. So I began working on the laser side of things. It was a new laser center. So I got to manage and assist. And I just fell in love with lasers in all aspects. I've worked with multiple different platforms, had training with a dozen or more different companies that manufacture lasers. And this has definitely become my passion.
So where exactly do you work? What's the name of your office?
Yeah, so now I am at Lemon Avenue Plastic Surgery and Laser Center in Dallas. I've been there for almost 4 years now, and I love it. We're in Uptown Dallas, a really sort of hustle and bustle area. The demographic of people that I treat is very, very diverse, which is amazing. And we are afforded the opportunity to have some of the best laser platforms in the business at Lemon Avenue.
Yeah, so tell us a little bit about what you do on a day-to-day basis, what type of services you offer.
Yeah, so I offer both in-person and virtual consultations. So my day is pretty sporadic because I could be doing a 3-hour halo procedure and then come out of that and go into a 15-minute quick consultation. So I prefer it that way. But I sort of specialize in heavier hitting procedures is the way I like to put it. I do a lot of ablative resurfacing. I do a lot of deep invasive procedures, especially on skin of color.
Yeah, I think I saw you commented on a post about the halo laser for a darker skin type. And it was a Facebook group that, I try to not be on a lot because it's irritating, but
yes, same. I have to mute it every once in a while.
Yeah, I actually, there's a snooze button on there, and I try to snooze it every 30 days because, once in a while I'll go on there just to see kind of what's going on. But you had commented on treating a patient. I think she had hyperpigmentation. She was a skin type, I think 5 or 6.
Yeah.
So I looked up your name and I went to your Instagram page and I was blown away by the before and afters and how just diverse your profile was and the results that you can see with some of the lasers that you use. And I had never heard of the halo being used on a darker skin type. So can you talk a little bit about that?
Yeah. So when I first started using Halo, first time I got my hands on it was in 2016 when I was assisting, well, maybe early 2017, when I started assisting another laser provider. And that provider pretty much only treated Caucasian skin, if I'm being very honest. But I wanted to know if I could have the procedure done. And so I tested it on the back of my hands and things like that after hours and kind of was like, oh, yeah, we can kind of play with this. And I did hyperpigment the back of my hands because my settings were entirely too strong. And then I did build trust with that provider, and he did do a halo on my face that was successful. The settings were very low, in my opinion, now that I know what I'm doing. But I understand it was because of, he was fearful of messing up my skin. So over the years, I just dived into everything Sciton has online that explains how the different wavelengths work and how deep into the skin that they go. And I just had family members and friends kind of come in and let me just try it. And I did some things that absolutely did not work. And kind of came up with this protocol that I use now that that uses the technology, the blended technology of the two different wavelengths very well. And I am very careful when I talk about using Halo on skin of color, because a lot of people want to say, oh yeah, is it safe for skin of color? I don't say it's safe for skin of color, because putting safe, skin of color, and laser, those three things in one sentence just don't work. There is a risk no matter who you are and what you look like if I put laser energy on you. You could be a Fitz one, the fairest of the fair, and I could burn you potentially if I do the wrong things with any laser. So I'm very careful to say it's not that Halo is safer than anything else. You have to know what you're doing through trial and error, through education, through understanding the skin and what a cross section of skin contains and how the laser works with that cross section of skin. What chromophore are we looking for? And the good thing with Halo is it looks for water content. It's colorblind in the sense that it's not looking for pigment. It's not seeking out pigment. If you use a pigment-based laser on skin of color, you run into a little bit more of a struggle, in my opinion, with choosing your settings, because it's looking for pigment, and I'm pigmented. So is it going to see a melanocyte that's sent some tyrosinase to the surface and say, I want to kill that, and then do so, and now I've got a hypopigmented mark? So the chromophore being water plays a really big part in me using Halo on skin of color. I do have upwards of 20 different devices at Lemon, and about 10 of them I would put on skin of color, but that's because I've done it with trial and error. I have hyperpigmented patients. I have hypopigmented patients. So because I've learned from the mistakes that I've made in the past and don't repeat those mistakes, I'm comfortable putting lasers on skin of color. And I think that's a key part as well, because a lot of providers will say, well, I'm just going to do it. I'm going to go out and try. And they just want to keep doing that same thing over and over again. And that's where I run into a lot of burns, a lot of PIH that come and see me after they've seen another provider in hopes that I can fix it. And I don't even promise anyone that I can. I tell them I can try to blend it the best that I can and educate you on what went wrong so you don't do it again or allow someone to do it again. But I think there's a lot more, as you both know, that goes into putting lasers on skin of color than people put out there.
Right. Well, and also, can you just tell the audience in general what skin type you are on the Fitzpatrick skin type scale, since you've used Halo in general, just so they can know?
Yes, I'm glad you asked that, because that's interesting. My counterpart is what I like to call him. His name is Taylor at Lemon Avenue. He would probably classify me, as other people would, maybe as a 5. I treat myself as a 6. And that is because I know that I hyperpigment very easily and I keloid. So when you're thinking about the Fitzpatrick scale and you're looking at someone that you're questioning and saying, where am I going to put this person on the scale? I think it's a lot more than just looking at their skin and saying, oh, well, they look like this, so they're going to be a 5. What is their DNA ancestry? How do they tan? What color are their eyes? What color is their natural hair? Look at their legs, their arms, look at their chest. So I think that for me, treating myself as a 6 allows me a little bit of leeway to do more of a low and slow approach for my skin, than to treat myself as a 5 like some other people would and possibly run into more PIH. So I treat myself as a 6.
Yeah,
Thank
and I
you.
think a lot of the from my experience with the laser companies, when they come in to do a laser training and they have the parameters and all of the protocols, it's just one sheet, skin type 1, skin type 2, and these are the parameters that you use for those.
Yeah.
So that's when a lot of burns and a lot of complications can happen, because you're just going off what they've skin type, but you're not asking about their history with lasers. How do they hyperpigment?
Right.
What other treatments have they had? So, and a lot of that, and I'm a laser trainer with Luminous and with MRP lasers. And sometimes these doctors don't want to spend 6 hours or 8 hours training in an office. They want it done in 3 hours, and they want to go and see their patients. And I actually have trained 2 doctors this past month that have never touched an IPL. And they all wanted it done.
Wow.
In 3 to 4 hours. Yeah, actually one of them was 6 hours, but this past week she wanted a 3-hour training, and that was it. So,
Yeah.
and all of her patients were like in type 4, tan, they've been in the sun, and I'm like, we send them all the protocols first, but you don't have a lot of control over who they're going to choose for a model, even though you go over all of the, the qualifications. But yeah, a lot of the laser trainings, they don't go over that. And I try to do my best to talk to those providers about that, about making sure you're asking more than just what is their skin type? How do they hyperpigment, their history?
Yeah, I think that training, honestly, is and this is no, I never want to talk down on anyone, but training is one of the main reasons that I decided to dig deeper and just try things on people, because I would sit in these trainings, and I am a note taker for sure. And I would go back through my notes and I would see, oh, here are settings for a scar or settings for a stretch mark, and they would specifically say, yeah, this is great for Fitzpatrick 1 and 2, or 1 through 3 is like the like honed in area where everybody says this is great for Fitzpatrick 1 through 3. And I'm like, okay, well, what about everybody else? Like, are we supposed to just assume we can't put this on them? Yeah, like there are so many people that fall in that category. And so when I walk into a room, I'll say in Dallas, I'm pretty known in Dallas for what I do. When I walk into a training room in Dallas, I feel the air change if the people there didn't know I was coming. The conversation switches just a little, and it'll more so turn into, well, this is great for Fitzpatrick 1 through 3, but Theresa, how have you been using this on, and I'm like, I'm here to get more information from you guys about how you guys are applying it. And if you didn't think about how this works on 4 through 6, that's something you need to work on, because I'm not the only person that needs to hear how does this work for 4 through 6. So it's interesting to me. I try to stay in my lane and keep my scope of practice in mind, with what I do, but I do love educating and I do love helping other people. I get tons of inboxes from other providers that see my pictures and ask, what were your settings on this patient? And I used to be quick to share my settings thinking, yeah, absolutely. Like I want everybody to be as successful as I am. I've stopped doing that because I noticed that people just take my settings and put them in the machine and hope for the best without understanding what does this actually mean. And like I said, we have so many different platforms at Lemon. I do a lot of combination treatments. So even with my Halo, I might grab my Pico 4, which is a pigment-based laser that I use for tattoo removal if the patient's got some melasma, so I can kind of break that up using picoseconds. You have to understand if you're going to put, picosecond energy on the skin and then go in with an ablative wavelength like erbium on top of that, or the non-ablative factor on the Cyton, how does that affect the skin? So I think that in training, those are things that aren't thought about as far as applying it to the skin. And also another thing that's huge is, how do you spot an indication on darker skin? If you say I've got hives and you're a Fitzpatrick 1, the hives are very, very noticeable. You know when someone has a hive. When I break out in hives, it looks very different than it does on a Caucasian person. So I might walk into an office to get a procedure done and have a flare up. I have rosacea. I might have a rosacea flare up going on, and they don't recognize it as rosacea because they've been taught rosacea affects white skin, and it actually affects all skin. So I think that that's a huge part in applying lasers to skin or even products, recognizing that different indications present themselves different ways. And if you're not trained to see that, you can very well mess someone's skin up far worse than it was when they came to see you attempting to fix it.
When I think too, like one of the main issues in general with skin of color, like when people look at Fitzpatrick's 1 through 3, they're thinking of those things. They're thinking, yes, there's, multiple skin issues per individual, but for some reason with 4 through 6, we're all kind of lumped together. It's almost like,
Right.
we all share the same exact skin disorder. We all share the same exact, thing. And it's like, no, we are still individuals. You have to individualize each case, understand exactly what is going on with their skin, number one, but also to understand that my skin is going to react differently from your skin and from Marissa's skin, So I think that's just another issue that I've kind of seen also in the aesthetic industry.
Absolutely. I think that also carries over to healing. When we're talking about doing the deep ablative resurfacing that I do, when I have to explain to every patient how they're going to heal, that's going to look different per patient. A lot of patients want to say, oh, well, show me pictures of what healing looks like. Well, I don't have a patient that's going to heal exactly like you. I can give you a roundabout estimate of what this is going to look like and about how long your downtime is going to be. But I'm one of the few providers, I think, in the industry that is as communicative as I am. All of my patients will tell you they text me pictures every day for 14 days after every procedure, no matter how deep I've gone in the procedure. If I'm doing a thulium-based treatment that only, gives them 1 or 2 days of downtime, I still want 14 days of pictures. And that's just because I want to see how that first 2 weeks is going, and be able to tell my patient, yes, that looks normal, or no, that doesn't look normal. Maybe your swelling is a little too much. Do you need a medication? Do you need to pop back in and see me for the PIH I already see coming up? Things like that. So definitely recognizing that with different people, even along this lumped in category of 4 through 6 that they have out there, we all definitely look different before the procedure, and we're going to look different after.
Which that also brings me to my next question then. So what are some challenging cases that you've had? Like any burns, any botched treatments for skin of color?
Yeah, I have done some crazy stuff. My most memorable treatment, I think I had a patient that was a Fitzpatrick 6. He flew in from Sudan to see me, found me on Instagram. And he had branded marks on his back from tribal things that he had done in his past. And he wanted to come to America and be here, and not have that stigma on his back from it. I mean, it looked like branding marks. And it took a lot of convincing him that I could not just take a laser and burn that off, because that was what he kept saying. Can't you just burn it off? And so it was a lot of education, and it was a lot of ups and downs with him. There was language barriers, things like that. But that was definitely my most memorable. I actually only lased him once, after 8 months of treating him topically, trying to get some of the pigment out. And we were successful to get things to blend. But he's one of my most memorable. And that wasn't a burn necessarily from laser, but definitely a tougher case. Specifically a burn from laser, I had a patient who was a Fitzpatrick 4. She was Asian, and her father was like a third Hispanic or something like that. But no one had asked her about her DNA ancestry. No one asked her where people came from. And so they'd been putting IPL on her for years. And she said, oh, I just love my IPLs. I get flaky and then it comes off. And then about 2 months later, I get these really dark marks on my cheeks that come back. So I just keep going back for more and more. And so she had melasma, and nobody had ever told her that she had melasma.
I was just about to say, so nobody ever said anything.
No. And she was just every, quarterly, just going in for these very intense IPLs. And it was hard for me to tell her, I will not put light-based energy on your skin. We're going to treat you topically to try to suppress your melanocytes first, and then we can talk about what type of resurfacing we could do to get you better texture. But as far as that color goes, we've really got to get in there and suppress some of this, because not only do you have your melasma that is exacerbated by heat, raising your core temperature, going outside, your hormones, but now we're putting light on this as well every 3 months, and your body's going crazy. So for me, it's just educating people on what have you previously been getting done that maybe wasn't the best option for you, and what can we do now without downing previous providers that have done things, because I understand that people don't know. And until you can't do better. So I'm just hoping that things like this can get it out there. And maybe someone heard me just say that and they go, I do have a Fitzpatrick 4 that I'm putting that might have melasma that I'm putting IPL on. Maybe I need to revisit that treatment plan and find something better for her. So no, I really appreciate that question, because I wish that I had heard someone answer that when I first started, because I've burned my fair share of people. And I will say, luckily, it's always been family, because I only cowboy on people I know. So that if I do, mess them up, I can tell them, I love you so much, I'll fix that later. But I've learned in the process. So.
Well, and I love the response that you had with when you just said, like, you're not trying to make the other company that did do that IPL, like, you're not trying to bash them, which I love that, because, at the end of the day, we're all in the aesthetic industry. We are all trying to help the clients that are coming in. Now, there are some people that aren't helping them correctly, but that's where you come in. That's where we come in, to be able to educate them without bashing them. And hopefully they'll run across these videos so that they'll be able to learn and then use that same exact, knowledge to their patients without feeling like they've been attacked.
Yes, for sure.
Mm-hmm. So my next one is, so any advice that you would give to any aesthetic providers to gain knowledge from lasers in general?
I think the biggest thing is, don't be afraid. I don't like to say be fearful, but I think a healthy amount of apprehension before you hit go or start or push that pedal is always a good thing. I double and triple and quadruple check myself. In the middle of my treatments, I often stop and check my settings and, get my temperature gun out and check the surface temperature of someone's skin to make sure that I'm doing what I need to be doing. So I think that just having checks and balances in place is a huge thing. Charting is another thing for me. When I first started in lasers, we really weren't charting what we were doing. It was kind of like a patient had X, Y, and Z done on this day at this time and consented to that laser, but settings weren't recorded. And how was the person after? And that's why I follow up and I get documentation for 14 days on how the patient was doing. That's all in my charting. So I think it's wise to make sure that you're checking yourself every step of the way. Don't depend on other people to do that for you, because you can fall by the wayside and be one of the providers that are doing things they shouldn't, just by kind of listening to what other people do and just blindly following that. Just own what you're doing, and have accountability. That would be my biggest thing. Have accountability.
I love that. Yeah. Well, and I love the document part, because they always teach us in nursing, if it isn't documented, then it isn't done.
It didn't happen.
Exactly.
So
Yeah.
document. Mm-hmm.
Yeah. So I wanted to ask you just kind of a side note, Theresa, because melasma is one of those treatments that, I've treated with IPL, but it's multifactorial, and, there's different types of melasma. And one of the companies that I train for, I won't say which one, but they do have a setting on their parameters to treat melasma, but the companies don't have any studies that have been done on it. So what would you say as far as, do you treat melasma with IPL in certain cases, or is it just a hard no for you?
It was a hard no until about 2.5 or 3 years ago. I'll be very honest. And then I had a patient come in with the worst melasma I'd ever seen, and I tried everything else, and then eventually tried very low and slow. I used a different form of IPL, broadband light, but I did use it successfully in conjunction with topicals and other lasers. So yes, I'm a firm believer that any of the lasers that I have could pretty much be used for anything, if you find a way to do it that's safe. I think that there's a lot to be said about melasma, and yes, thank you for pointing out that there are multiple different kinds of melasma. I think that number one out there for laser providers is, if you suspect that a patient has melasma, don't just jump and treat it as melasma. You need a doctor to diagnose them with melasma. So I'm very careful to tell my patients, it looks like you've got what's called melasma. I want to educate you on what that is, but I'd love for you to see a dermatologist, get an official diagnosis. And once you have that, the treatment plan that I have in mind will fall into place much better, because I will have the backing of your provider that has diagnosed you with that, and I know what I'm treating. So I am still a little scared of light-based treatment with melasma, just because I've just seen some terrible things with it. But it's not a hard no for me. It's just very case by case. But I would love, on a separate date, obviously, to pick your brain about how you apply it to melasma, because I love to be able to offer that in my practice more so than I do now.
Yeah, I mean, just a couple tips that I've learned over the years. I mean, it depends on how long they've had it. You know, if they've had it for decades, then those melanocytes are probably really deep, and they have dermal melasma, and that's going to be more heat sensitive. If it's more recent, then it's usually a little bit more superficial and can respond a little bit better to IPL. But you know, most of the melasma patients that I've had love the sun. They love their Hawaii trips and their Cancun trips, and you know,
Yeah, 100%.
so to tell them that they need to stay out of the sun and that they, you know, they they can't get their tan in Hawaii, it's like taking away their left arm. So it's lifestyle, and you know, they just have to accept that, you know, this is heat. This is not just from being out in the sun and sunbathing. This is from even hot yoga and saunas and running, you know.
I was about to say strenuous exercise. Yes, all the above.
Yes.
Right.
Yeah,
And
living in Dallas,
yeah,
we have a lot of hot yoga instructors, and you know, it was 116 degrees 2 weeks ago here in Dallas. So I have a lot of patients that I have to tell, I am not telling you to change your lifestyle, but I am telling you that if you do hot yoga twice a week, you have an infrared sauna in your house, you also teach and instruct golf on the side, you know, I can't do my heaviest procedure on you and expect you to heal well. So it's going to be more, and I keep saying low and slow. It's going to be more of that low and slow approach. We're going to do multiple different sessions, you know, maybe with the same laser or maybe with different lasers to try and get your melasma under control. We're also going to use some topicals so that when I'm not touching your skin, you're still maintaining your beautiful results. But to a degree, your melasma is a part of who you are. You've got to accept that this is a chronic condition that I can't cure. So you're always going to have it. And there are going to be stages in your life that exacerbate your melasma that are beyond your control. So whether that's hormonal issues or just raising your core temperature from walking outside. So I think melasma is definitely one of the trickier ones. And I will say that maybe 30% of my melasma patients are dermal melasma. Most of my melasma patients are epidermal melasma. So it is a little easier for me to give them an Arbutin or a kojic acid product, use it for 6 to 8 weeks to prep the skin. And then by the time I get to them with Halo or whatever I've chosen, we've already suppressed so many of the melanocytes that all I'm doing now is polishing, so to speak. So now they've got a good glow that lasts them about 6 months. And at the end of that 6 months, we have to come back and reevaluate what the next step is. But, you know, I don't see too much deep melasma. And honestly, when I do, those types of patients are usually at their wits' end, and they've tried so much that even giving them an Arbutin-based product and a kojic acid product just gets them so much, you know, that 20% of lightening it feels like everything for them.
Well, and what we've started to do at my clinic, we've, for those people that, like you were talking about, Marissa, that just love being out in the sun. Well, if we know that they're going to be out in the sun, we'll tell them we'll see you in the fall and we'll see you in the wintertime so that we can at least hit that melasma. And then like during that summertime, when we know that you're not going to listen to us and you're going to be out in the sun, you know, we'll at least give them something or like a brightening agent or something like during that season so that they can at least have something before they get to the the months where we're actually going to be hitting that melasma for them. So it's just those. I mean, I can understand the sun feels nice in the summertime. We all want to be out there, but
I love my tan right now. I can't lie. I still have my Cancun tan, and you know, I'm born and raised in Southern California. It's just part of our lifestyle. So yeah, I mean, and I think that, you know, with for anyone that's working in a med spa and seeing patients day to day, you know, it gets really busy. And one of the spas that I work at once a month, we see patients, you know, every 30 minutes. It's back to back 20 minutes, 20-minute appointments, 20 patients a day sometimes. And I think a lot of those questions are getting missed in that initial consultation. You know, it's okay, getting your good faith exam done, and maybe having them fill out a consultation, but we don't have time. Sometimes we don't have time to go over everything. So asking those simple questions about their lifestyle and how much time they are in the sun. And I think that, you know, if we're catering and talking to med spas and helping with med spa education, if you're listening to this, I really encourage you to look thoroughly into your patient's history and what their lifestyles are, because that will determine a lot about how you're going to go about their treatment protocols and how they're going to respond. Because I think a lot of that gets missed.
Well, and I think too, to add on to that, just like when you were talking about like their lifestyle in general, sometimes they may not put every single thing on that paper about their lifestyle. So sometimes just like having that piece of paper, having that information, but then also asking them like, you know, really quickly, like, how often are you in the sun? Did you just come from the beach? Did you just, you know, just ask those questions right there also, just so that you can sometimes get a better answer. Because sometimes they're not as, I guess, open about it when they're just writing on the piece of paper. Sometimes they're just trying to hurry up and finish it up and not give you the full details. So sometimes it is nice just to ask an extra question, just, you know, their lifestyle right then and there. So
Yeah, I think that one thing that's helped me a lot is I do my initial consultation. So consultations are required to see me regardless. So whether it's virtual or in person, um, I do my initial consultation as sort of me meeting the patient. And then before I'm going to do a procedure, and I'll use Halo as my example because that's my sort of longest and biggest procedure, there is an hour time where my patient has to numb. The first 15 minutes of that is photos, discussion, what I call a reconsultation. So I go over, here are your expectations for the day. You're going to be red, you're going to be swollen, no sun exposure in the last 2 weeks, no sun exposure for 4 weeks after the treatment. Are you okay with those things? Yes, I am. Okay. So then we get into what have you been doing lately? You know, I'm numbing them, I'm taking pictures. During that time, they're relaxing a little bit more. And then they're like, oh yeah, we went to the beach. We did. And I'm like, okay, I just asked you, did you have sun exposure in the last 2 weeks? So there have been quite a few, more times than I care to honestly admit, where I've actually turned patients away on the day of their procedure. They've taken off work, they've flown in to see me, they've done whatever, but I can't treat them because they've been in the sun, or because they're going to be in the sun, or because they've got a photo shoot in 5 days and I told them they needed 9 days to heal from the procedure. So I think that asking questions more than once, on the day of the consultation and then on the day of the procedure, oftentimes gets me to catch patients on things that maybe they thought they were being honest with me about, but to them, sun exposure wasn't, I was at the beach and I was under an umbrella. Okay, but you were still in the sun. You still had sun exposure. I can't do this to you. They think I'm asking, did you lay out with nothing on your skin? So I think that making sure that asking the questions multiple times, maybe in different ways, not just yes or no, open-ended questions sometimes helps a lot.
Perfect. All right. Well, do you have any other pearls, or I feel like we have you here with us and I don't have any more questions, but I know I'm probably going to message you later and pick your brain a little bit more. But do you have any other closing thoughts or anything else you'd like to share?
I really just want to say, if you are looking to get into this industry, especially to treat skin of color, do it. Like, we need more of us. We need more people that are passionate about making a difference in our community, about helping people feel better about the skin that they're in. Your skin is your biggest organ. You have to take care of it. So we need to be able to educate each other and help each other, do things the right way. So if anybody out there has any questions, I'm an open book. I'm always willing to answer them. And I just can't wait to meet some of you in the industry.
Yeah, and we will meet you hopefully in October at ICE.
Yes, at IceFan. Yes, I cannot wait. I'm so excited.
Yes, I know. Mm-hmm. Jacqueline and I need to get working on our abstract, but
yeah,
we work
when
really
get to
good
that
under pressure, and we're good procrastinators. So.
Oh, so am I. So don't worry. And I've got my notebook ready to just write down everything you got. I can't wait to soak up all the knowledge.
Yeah, I'm excited to meet you in person. Where can people find you? What's your Instagram, social media?
Yeah, so my Instagram is real easy. It's just Theresa Does Lasers. So Theresa with an H. That's really the most active platform I'm on. I also have a TikTok where I do some educational videos and things like that. But Instagram is going to be number one. And then I am located in Dallas, in Uptown, at Lemon Avenue Plastic Surgery and Laser Center. And I just got word that our website is being revamped, and there will be an area on our website dedicated to melanin-rich skin. And I am so looking forward to that. So keep an eye out for that. I will obviously, announce when that goes live. And I'll be doing educational videos on that part of the website just to kind of give more insight into what I do and what I can do, or maybe what I can't. So yeah, look forward to that.
Amazing. That's amazing. You're a true leader, and we're so lucky to find you. I mean, look what Instagram and Facebook did.
I know.
Yes, right? Social media to the rescue.
Mhm.
Thank you for taking time out on a Sunday to talk with
Of
us.
course.
And we will meet
Yeah.
in person in October.
All right. You guys have a wonderful day.
Okay,
Thank you.
bye.
All right. Bye.